myself, Dr. Naveen Kumar Hosalli. I am Assistant Professor in Department of General Medicine, working at KLE's JGM Medical College of Hubli. So moving on, today I'll be dealing with one of the most common non-communicable diseases of our country, that is hypertension. So before knowing hypertension, we need to know what is actually a blood pressure mean. So basically, when a heart beats, or every time when the heart beats, it pumps the blood from the heart to the various blood vessels. So there is a pressure created among this while the heart is beating. So when the heart beats, it exerts a pressure on the walls of the blood vessels. That is called as blood pressure. So basically, throughout a day, our blood pressure varies over the time from whether it's morning to the evening. So the normal blood pressure, what we call is around, when we call of upper BP, that is SBP, it is between 100 to 120. And we speak of the lower one, that is about 60 to 90. Whenever the blood pressure is higher than the normal limit, then we call it hypertension. So high blood pressure usually develops over the time. It can happen because of unhealthy lifestyle changes that we make. It can be because of physical inactivity, obesity, smoking, and even alcohol consumption, or even stress can induce hypertension. So there are many various risk factors that can cause this hypertension. So I'll just name some of the most common risk factors that leads to hypertension. One of them is age. As I said, as the people gets older or becomes elderly, the arteries stiffen up. This can cause narrowing of the blood vessels, can cause arteriosclerosis, and in turn leads to hypertension. That is one thing. Next thing is family history. Whenever we have seen that various patients present to us because her or his parents are suffering from hypertension. So usually one of the close family members are having hypertension. Again, there is a possibility of developing hypertension in them also. Next part is regarding our diet. So as we all know, excess salt intake can lead to development of hypertension over the period of a time. When we consume the foods which are less in potassium, even that can lead to causage of hypertension as well. So along with that, as we've seen nowadays, we eat more of very junk diets that are found roadsides nowadays. So eating those processed and fatty foods, and as well as the junk foods, can lead to development of hypertension over the time. So next, one of the most common, I would say, the risk factor would be the stress. As we all know, mental health is very important for us. When we are unable to manage our stress or unhealthy lifestyle, 100% leads to development of hypertension. So moving on, the next part I would like to speak on about is the symptoms of hypertension. Hypertension usually doesn't cause any specific symptoms. It is usually called as silent killer, as it doesn't present with any symptoms. So some patients might present with history of headache, or some might say there might be giddiness, or even some persons can present to us with history of easy fatigability. So that might be the most common presentations usually. But most of the time, more than 75% of the time, the patient usually doesn't have any symptoms when they develop hypertension. So knowing that, what are the usually, as we know, now I said that it's one of the silent killers, as it doesn't present it to us with any signs or symptoms. We need to monitor ourselves day to day life, so that we'll get to know when exactly we'll be under the risk of developing hypertension. So having known about risk factors and signs and symptomology, now I would like to say how to measure this BP exactly, and what is exactly hypertension, how to define it exactly. So as I said previously, our normal blood pressure would be 120 by 80. And whenever this the value is more than the normal limit for a longer term of duration, then we call it hypertension. So what is it 120? 120 is nothing but, it is called as systolic blood pressure. And what is that 80? That is nothing but diastolic blood pressure. Systolic blood pressure means it is the pressure exerted by the heart on the blood vessels when the heart is contracting. So when the heart contracts, it exerts a pressure on the blood vessels, that is called as systolic blood pressure. So whenever the pressure exerted when the heart is relaxing, that is called as diastolic blood pressure. So when it contracts, it is systolic. When it relaxes, it is diastolic blood pressure. So when these two blood pressures are being measured and the range is above the normal limit, as I said, it's above the 120/80, we call it hypertension. Various guidelines have been laid to when to exactly call hypertension. We have seen that when the blood pressure is greater than 140 to 90, then only we can call it as a hypertension. So if the patient has blood pressure between 130 or 120 to 140, or the diastolic between 80 to 90, then we can say that the patient has a pre-hypertension stage. The patient has more possibility of getting hypertension in the future time if he doesn't do certain lifestyle changes that will in turn leads to increase in blood pressure over the time. So always we should there's a cutoff range. Exactly, there are very much guidelines. I would like to say American guidelines says that if the blood pressure is greater than 130/80, we call it hypertension. European guidelines say if it is greater than 140/90, again we call it hypertension. So both the ways, if the above the normal limit for a longer term of duration measured more than 2 times, we can say that the patient is having hypertension. At this point of time, I would like to say that on May 17th of every year, we usually celebrate a World Hypertension Day. It's a day dedicated to highlight the importance of monitoring the blood pressure and bringing the global awareness among the people to know about the blood pressure, its impacts on us, our lifestyle. So that is the one we usually celebrate every year. This year themes was measure your blood pressure, control it, and live longer. That was the theme of this year. So knowing about and having known about all these things, now I would like to say certain points which will help us to prevent this hypertension, how to prevent this development of hypertension. First and foremost thing I would like to say, physical activity. That is the most important factor in nowadays to prevent development of hypertension. So usually we would like to say that brisk walking for about 20 minutes a day, 100% will have a better impact on lowering the blood pressure. So walking every day will 100% has a positive impact. So everyone should walk, as obesity is again one of the risk factors. So it will 100% decrease this obesity and can have a good control on blood pressure. Second thing is about the diet. As I said in the previous slides, taking more amount will lead to higher blood pressure. Small amount of salt will lead to higher blood pressure. So taking less amount of a salt, 100% will have a better impact on preventing the development of hypertension. Next thing is about eating the junk foods, various processed foods and all, that will have a negative impact. So preventing eating them 100% will have a positive benefit. So people should have a better lifestyle changes, better diet changes in their lifestyle, so that they will have a lesser possibility of getting hypertension in the future. So next thing, there are certain various diets are also being mentioned. For example, DASH diet, they say that is a dietary approach to stop hypertension, or a Mediterranean diet again. So where we advise the patients to take more vegetables and fruits in their routine consumption, as well as we say to eat less saturated fatty foods, as well as total fat foods. And also we ask them, the patients, to take a lot of potassium rich foods. And we also say along in that diet, we say to take less salt. Usually less than 5 gram is recommended label. Always take less than 5 gram per day diet of salt. That is again one of the most commonly followed approach to prevent hypertension. Always you need to read the labels of various processed food that you're going to get. So read the labels, see how many amount of salt is being put up in those, and prevent them if the packets have more amount of salt in it. Prevent from eating those things. Next thing is our habits. As 100% we have to control our habits. As I said, smoking and alcohol drinking has a very negative impact on our personal life. Not only about the hypertension, it can also cause various other diseases, cardiovascular diseases, cardiovascular deaths. So always have a control over our habits. Drinking daily, a lot of amount of alcohol along with smoking daily will have a negative impact. Next thing is always you should remember, self-care is the best healthcare. So monitor your blood pressures on a yearly basis. If you are young, greater than 40 years of old, 100% you have to measure your blood pressure at least yearly once. So do your self-monitoring, watch out for your blood pressure levels. If it is increasing trend, meet a doctor nearby, have a word with him, take all the preventive measures that I said, take a healthy diet, have a good walking or regular activity daily. So that can prevent development of this hypertension. So always monitor yourself well, and also take care of your elderly. As we all know, elderly has a greater propensity to get hypertension. So take care of those people as well along with you, so that you can even prevent hypertension in them as well. Next part I would like to say is about the our most important health, that is mental health. So stress management is the most important thing. Nowadays we can see many of people suffering from various day-to-day stress, day-to-day stresses that they are now going because of our hurry-burry lifestyle, I guess. So that can have a negative impact and in turn causes hypertension over the time. So have a good mental health, do yoga, do exercises, uh, do all the stress management, or listen to some good vibe of musics, or even go to a calm place so that you can have a better mental outcome, I guess. So do those things that will help to manage your stress, so that your blood pressure remains on the normal side on a various limit. The last and important part I would like to say, if you have developed hypertension already and you are started with certain medications, stick on to your medications, adhere to your medications, so that the blood pressure will not vary that much as we see nowadays, and it will be under control all the time. As we know, the hypertension over a long term of a time, it is very high, greater than 160/80 for a longer time of duration, will leads to stroke or cardiovascular deaths or coronary artery diseases, heart failures. Okay, various other organ damages can happen because of hypertension. So we can prevent this all possibility of developing these kind of disorders by maintaining a blood pressure in a normal limit. So always adhere to our medications so that these things can be prevented in your life. So at last, I would like to say there is nothing more precious than having a fit and a healthy life. Adapting healthy lifestyle can help us to enjoy long and a healthy life. High blood pressure can 100% cause a negative impact on our health. Keeping the blood pressure in check, monitoring it daily is a very important factor in our life. Self-care, as I said, is the best healthcare. Monitoring your blood pressure daily, or if you're hypertensive, or you can at least get it yearly once done when you're not hypertensive and you have possibility of getting it. Monitor yourself, actually, monitor yourself daily. And it is much possible to maintain blood pressure levels with a regular monitoring and a preventive care. So do that so that you can maintain a good health in your good health. So the tension in that hypertension should be removed. So manage your mental health as well so that you can prevent the development of hypertension. So thank you.